Okay, my name is Alicia and I'm a CMU PA student, and I'm going to show you how to suture interrupted with instrumental tie. So indications are suturing is used anytime there's a laceration, wound, or gap of tissue that will not approximate or heal without attachment. Sutures apply intrinsic tension on a wound to counter the intrinsic tension of the tissues pulling apart, and they're used in nearly every surgical procedure to ensure healing of lacerations and wounds. Interrupted are less likely to become infected or spread infection and are more secure than continuous. And some contraindications for suturing is the wound should not be sutured if doing so would increase the risk of wound infection, lacerations through the infected skin, deep puncture wounds, wound with foreign debris that can't be completely removed by irrigation or debridement, superficial wounds that would be expected to heal without significant scarring, lacerations or abrasions that only involve the epidermis, and then other wounds that should generally not be sutured are dog, cat, and human bites, wounds older than 24 hours, or in patients with risk factors for infection or poor wound healing, like immunocompromised, diabetics, and then lacerations with significant tissue loss where suturing will cause too much tension across the suture line. It's important to choose the materials and techniques appropriately. For example, the delicate suture and techniques used superficially on the face would be contraindicated to close the uterus after a cesarean section procedure, and the sutures and techniques used to close a total hip would be contraindicated if suturing a superficial laceration on the forehead.
Hi, I'm Mita White. I'm a PA student at CMU, and I'm going to tell you about the complications, possible complications with suturing. First and foremost is the possibility of infection and then scarring as it heals. If the sutures are tied too tightly, they can strangle the tissue, and this causes tissue ischemia, necrosis, and dehiscence. And you can have excess eversion. This occurs when the growing layer of the dermis and the base layer are in contact with each other. So you need to be careful not to over-evert because this leads to poor healing. And then finally, inversion can occur. This causes the dying layers of the epidermal edge to be in contact with each other, and that also leads to poor or delayed healing. So we want to try to avoid these complications with appropriate apposition and appropriation of the wound. Okay, Alicia will now demonstrate the uninterrupted suture technique. She's holding the needle with the needle driver approximately 2/3 of the way across the needle. She's going to grab the skin with her adds and forceps and enter at a 90-degree angle, turning her hand like she's turning a doorknob to bring the needle through the skin, and then she will re-grab the needle, hold the skin with the forceps, and again enter at a 90-degree angle, driving the needle through the skin. She'll pull now that suture all the way through, leaving a slight tail at the end, and then she's going to throw her first knot by wrapping the needle driver twice and grabbing the tail to pull through that wrap. She's going to now throw her second knot by doing a single wrap of the needle driver and pulling the tail through from the opposite direction. She'll alternate direction with each knot, and because this is a 3-0 suture, she will do a total of 3 knots. Alicia placed her first suture in the center of the wound to help approximate and have good apposition of the wound. With this knot now, she's going to cut both the suture and the tail. And now she's going to place her second suture halfway between that first suture and one end of the laceration. She's repeating the steps she did earlier. And you can see that she's now halfway between that initial suture and the end of the laceration. She'll continue in this pattern, halving each space until the sutures are approximately equal distant from each other as they are wide. So approximately 1 to 3 millimeters between each suture.
Hi, I'm Isaac, and we got Tyler here, and we're going to be doing the one-handed surgical knots. Indications for this are synonymous with all other sutures. One-handed knot tying specifically is used in the surgical setting for like deep tissue, as well as holding instrumentation in place like drains during a chest tube. I'm about to explain the procedure while Tyler performs it.
All right, this is Tyler, and he's gonna do a one-handed surgical knot procedure. So first, he's begin by passing the needle and the suture through the two ends of the incision with your needle driver, and pass the long end of the suture into your left hand. All right, now get positioned to make sure the long end of the suture is held with your inferior hand, or inferiorly with your left hand, and with the short end of the suture held superiorly or in your right hand. To begin the knot, start by creating a locking knot at the base to maintain tension. There are two types of knots you can begin with. Tyler's gonna do a double throw, but you can also do a single throw.
So here, I'll show you here. So we can start, we're gonna flay over, and we're just gonna start. That would be one knot, but in our case, we wanna do a second loop here. So we're gonna pull it through twice, and that's gonna be your most secure locking knot right there. And yeah, you usually see the colors switch out, so. Okay.
All right. Now that the anchoring knot is complete, we can begin the one-handed knot tie. So when starting with this knot, the short end should be held inferiorly with the right hand, and the long end superiorly with the left. So the first square knot is completed by draping the short end over the third, fourth, and fifth digits in the right hand. Now lay the long end over the same digits. Next, with the middle finger, hook the long end and pull it under the short end. Re-lengthen the middle finger and hook the long end and pull it under the short end.
We're gonna do that one more time for you. I'm gonna slow it down, keep going. So we're gonna slow this down. So like that, we're gonna hook this outer suture, I should say, right here, and then re-lengthen this middle finger. We're gonna pull it through here and then extend here.
Yeah.
Okay.
Yep, and pulls the ends tight, placing tension with the index finger. All right. Next, the second square knot is completed by draping the short end over the index finger and splaying it inferiorly with the left, or with the thumb and middle finger. Next, cross the long end over the index finger and the short suture. Flex and hook the long end of the knot with your index finger and re-extend the finger. This motion will catch the short end of the suture with the volar aspect of the index finger. Complete the knot by sweeping the short end through and placing tension with the index fingers. Repeat this maneuver, alternating each knot and being sure to alternate sides with each throw. In general, the number of knots should match the gauge of the suture. Often, sometimes surgical knots can be upwards of 8 knots for one tie.
Oh, hey there. So, we're gonna talk a little bit about follow-up on this case. Number one, for most of these deep tissue-like suturing with the one-hand, two-handed knot ties, typically it's gonna be absorbent suturing. So you're not gonna have to follow the same protocols as you will with others and worry about the time frame to take those out. Before that information, please refer to another part of this video where these other students spoke of this. And additionally, just follow-up is just gonna be watching for any other signs of inflammation, redness, any typical complications that you can see with a deep laceration following surgery. That's all we got for you today. Thank you for joining us. I hope you enjoyed our video. Take care.
Hi, my name is Kate Smith and I'm a PA student at CMU.
Hi, my name is Emily Olpet and I'm also a PA student at CMU.
And today we're going to discuss and explain how to perform a double-handed knot.
So the technique for the double-handed knot tying, we're going to start by making square knots. So you're going to place the center of your silk or nylon suture over the area of skin you will be making your knot. Take one end of the suture in each hand using the third, fourth, and fifth fingers. Thumb and index fingers should be free to maneuver and pinch. Make sure there are at least 6 inches of suture on each side to work with. Make a C with your left thumb and index finger. Loop left thumb under the left string and lead rope to midline with your thumb. With your right hand, feed strand into the C created with your left hand. Pinch left thumb and index finger together to close the C. Pivot left wrist downward and through the loop. Pinch the right strand with your left thumb and index finger. Pivot left wrist and bring one rope up through the loop created. With your right hand, grab the right strand and tie the knot down. Cross your hands so the knot will lie flat. For your second throw, you're going to be keeping the suture grasped in your hands and return your hands to their original placement. Make a C again with your left hand, but this time loop your index finger under the left suture string and bring it towards the midline with your left finger. Feed the right string into the C and close the C. With your fingers still pinched together, pivot your left wrist upwards through the loop. With your right hand, feed the right suture towards the left thumb and index finger. Pivot left wrist downward and through the loop. Grab the right suture with the right hand and tie the knot down. Note here that you do not have to cross your hands to lie it down flat. To close the knot, alternate between throw 1 and throw 2. And remember to practice. Here's a demonstration of the double-handed knot tie from a downward angle.
So the follow-up instructions for all the sutures we've done in this video are basically the same. First, we want to remind the patient to keep the area clean, dry, and covered with a fresh bandage until the sutures are removed. They can replace the dressings or the bandages if they become wet. Educate your patient to watch for signs of infection, such as oozing pus, redness, or inflammation that might worsen. Also let them know that if there's red streaking, pain out of proportion, that they should return to the office or call as soon as possible. The duration of a suture staying in is an average of 7 to 10 days, although it depends on the location on the body. For the face and oral mucosa, it's 3 to 5 days. For the neck, it is 5 to 7 days. For the scalp, it is 7 to 12 days. For the hands, back, joints, upper extremities, or trunk, it is 10 to 14 days. And the lower extremity is 14 to 28 days after the suture should be removed.